Thank you, Deputy Speaker. I'm particularly pleased to speak to the member for Fisher's motion on why people will spend less on medicines under Labor. It's ironic that those opposite put up something about cost of living issue, and yet all they can come up with is scare tactics and complaints. The change referred to in this motion was one announced as part of this month's budget, and the Health Minister, my electoral neighbour and colleague Mark Butler, announced that the government would be introducing 60-day prescribing and dispensing for stable, ongoing conditions. What this will mean, in effect, is cheaper medicines for at least 6 million Australians who take one or more of the 320 common medicines safety assessed by the PBAC for this scheme. The list of medicines includes common medicines like blood pressure medicines, cholesterol, other regular ones. And patients will save up to $180 a year per medicine, and those on healthcare cards will save $43.80 a year per medicine. The change brings Australia into line with comparable countries like the UK, France, Canada. New Zealand has had 90-day dispensing for over 2 decades. The world didn't end. This change was a recommendation of the Independent Pharmaceutical Benefits Advisory Committee in 2018 and was ignored by the former government, a recommendation that could have saved Australians millions of dollars a year for the past 5 years, ignored. And let's be clear, the purpose of the health budget is to improve the health of Australians. Overseas evidence shows that longer dispensing times is not only safe, it actually increases medication compliance by up to 20%. Why would this be? When medications are affordable, people are more likely to be able to take all of their medicines regularly as prescribed. Each year, over 1 million Australians delay or go without medication because they can't afford it. Secondly, if you're going to have a gap in your medication, it's likely to be at the end of your script. Perhaps you haven't got to your GP on time. Perhaps you haven't been to the pharmacy to refill it. Gaps in regular medications have impacts on the management of chronic conditions and risk factors. This is good policy. But, Deputy Speaker, there's another great benefit of this move for longer dispensing times, and that is that patients won't have to attend their GP to get prescription renewals so regularly. And this means GPs will be freed up to see other patients. We all know how hard it is to get in to see a GP after 6 years of Medicare rebate freezes under those opposite impacted the number of doctors choosing to become GPs. And so, Deputy Speaker, this move is clearly the right thing to do for patients. However, I acknowledge that this has impacts on community pharmacists, and I have spoken to many of them. Community pharmacy provides an important and essential role in our system, and I know the Minister for Health is committed to ensuring this remains the case. The Australian health system is a blended public-private system, and it's important to the health system as a whole that we have a strong community pharmacy sector. However, we don't have unlimited resources, and the health budget needs to make decisions in the best interests of Australian patients. We are a country with an ageing population and rising prevalence of chronic disease. Demand for health services is rising, and we need to make sure the system is efficient. And this policy aims to address an inefficiency in the health system that sees Australian taxpayers and patients pay more for essential services than they need to. It ties up GPs for script renewals. It drives poorer health results from medication non-compliance. And this change affects 1.5% of pharmacy revenue. Crucially, every dollar saved by the government through this change will be reinvested in community pharmacies. Pharmacists have increasingly become providers of immunisation services. They will be funded to reach out in aged care for pharmacy reviews. Some states are running trials or inquiries into prescribing rights for pharmacists for certain medications or conditions. This will require a change in business model for community pharmacy, but pharmacists, and yes, the pharmacy owners as well, have been crying out for expanded scope of practice for years, and this Health Minister is looking into it. To be clear, looking at it because the entire health system needs a rethink, needs change, in order to meet the changing and growing needs of Australians. Perhaps the Pharmacy Guild should return to the negotiating table. Every year, nearly 1 million Australians are forced to delay or go without medicine that their doctor has told them is necessary for their health because they can't afford it. This will fix that.